Okay, so today's topic is TMJ trauma and splints. It's just a short little question and answer. I got an email yesterday asking what we use after a patient had like maybe a traumatic injury to their jaw, and now they have TMJ problems and limited opening. There's a couple of things we do, and actually we're in an area where we see a lot of sport injuries as well as snowmobile accidents at the, in the winter time, where patients may fall and hit their jaw, and then now they have quite a bit of pain as well as limited opening. There's a couple of things I've used over the years that actually seem to work really well. Now, oftentimes patients just can't open big enough to even get an impression. So if they don't have opening that's maybe 30 millimeters, you can't even really get an impression. So we keep in our office a disposable, kind of like a temporary splint. It's called a Lockwalizer, it's, you can purchase it in many places that carries it, and it's kind of, I think they come in small, medium, and large, and I think we use the medium. But what it does is it just gives you a tool that you can give to the patient right away, and it will keep their teeth apart and it takes the pressure off of the TMJ. And then we oftentimes give that to the patient just for a few days to use until their injury to the TMJ gets a little better and they have a little bit more opening. And we tell them, to use anti-inflammatories like ibuprofen if they're allowed to use that. And then when they have more of an opening, they get more of like a couple of finger opening that they get between their teeth, where we can get an impression for a more final splint. Then we have them come back, and we usually bring the patient back maybe like a week or two later and see how they're doing, and see if we can make them more of a final splint that may help them, with their TMJ pain. So first, if the injury was so much that they have this limited opening, we'll give them this throwaway water-filled pad, temporary kind of splints. And then once they're come back, if we can get a good impression, we'll make them a clear, like a clear acrylic splint that the lab can make, and then we do it in such a way that takes the pressure off of a TMJ. And I'll put a note here and put some pictures of the kind that we use, which is kind of like the spear splint. We get them from Great Lakes Orthodontics. Most of our appliances are made there. Nothing special about them other than all of our appliances fit when they make it. So we had good luck with them over the years, and I think we used them about 15 years or so. If you need these appliances, just give them my name, and then I think they'll be able to set you up with a prescription, or if you use any other labs, you might be able to send them the information from this video. Once you're able to make the patient of more of a final splint, the acrylic splint, if they still have quite a bit of injury to the TMJ and they still have limited opening, we recommend that they wear it even during the day. And actually, patients who have a lot of pain and a lot of trauma, they can function with them quite well. And of course, we have them stick to soft diet, definitely do a chewing gum, and then just until they get better. And hopefully there's no physical injury to the joint that to a point that's detrimental, and they have bleeding inside the joint. So make sure you take some TMJ films, and depending what diagnostic tools you have available, and make sure that you monitor injuries to the TMJ and see if their problems clear up shortly after the injury and shortly after you give them the splints. I hope you find this video helpful, and we talk about these things in our seminars, so we encourage you to look on our website or call us when our next closest seminar is to you. And we also have monthly webinars. Usually it's in the evening, so it's convenient for everybody. You're welcome to check the schedule. It's on our website, Nagy Orthodontic Academy. And hopefully you found this helpful, and make sure you subscribe to our YouTube channel. And so we'll be updating more videos, and send us any questions that you have, and then we'll make sure to cover those in the next video. I hope you find this useful, and we wish you the best of luck. Have a great day. Bye.